ADHD. ADHD is attention deficit hyperactivity disorder. It is a common neurological disorder of childhood. It usually is first diagnosed as a child but can continue into adulthood. Some signs and symptoms of a child with ADHD is that they could daydream a lot, forget or lose things, squirm or fidget, talk too much, make careless mistakes, have a hard time resisting temptation, have trouble taking turns, and have difficulty getting along with others. There are different types of ADHD as listed there: inattention, hyperactivity, and impulsivity. The diagnosis is made based on the DSM-5, and I'm not going to go into that a whole lot because it does take more time than what we have. But in order to be diagnosed with ADHD, they have to meet the criteria that's there. And they have to have, if they're less than 16, they have to have 6 or more symptoms. And if they are 17 or younger, they have to have 5 or more of the symptoms. And the symptoms have to go together with having the symptoms before they were 12 years old, and they have to be present in 2 or more of the settings. So they have to have these symptoms at home and at school, or at home and with friends and relatives, but they have to have the symptoms in 2 different areas. There has to be clear evidence that the symptoms interfere or reduce the quality of social life, school, work, and functioning. Also, the symptoms can coexist with other diagnoses like anxiety, depression, behavior problems. Developmentally, they can have a harder time learning and have language disorders. They could have physical conditions that go along with ADHD, like tics, that I wasn't aware of that. They could have sleep disorders or apnea. Off to the right is a map that I've downloaded just because it's easier for me to visually see things. So on this map, you can see that the ADHD diagnosis rates are higher in the South and lower in the West, with a 3-fold difference between the rates of higher and highest and lowest states. Also locally, I wanted to point out that 5 to 8% of school-age children and 2 to 4% of adults have ADHD. Again, here's another diagram that I'm using to show you how many children are diagnosed with ADHD. This is based on the US CDC statistics from 2014. And the first one shows that ages 4 to 10, there's 1 in 15 children that are diagnosed. Ages 11 to 14, there's 1 in 9, and ages 15 to 17, there is 1 in 10. Contributing factors, or the social determinants related to ADHD, is financial difficulties and housing, which often go together. This could be an adult with ADHD that has a hard time holding down a job, which affects them financially, or a child that is born into that situation or lives with parents that have a hard time with finances and housing, heating, and having food. So they've also found a relationship between younger parents or single mothers. There's often less parents' involvement in ADHD kids. The parents often have mental illness, like depression or anxiety, and that affects the parent-child attachment. Their nutrition isn't as good as it should be. Often they eat food that are high in preservatives and have additives like coloring that can increase the hyperactivity side of ADHD. And then there's family adversity, so partner cruelty, substance abuse issues, and criminal involvement, often in the homes of kids that have ADHD. Here's a graph. I'm not going to go over them because we are limited on time, but again, it's good for me to be able to visualize and see the rates of ADHD related to racial and ethnic disparity. And this again it's just a graph, but a different type of graph of ethnic disparity and the percentage of people that have ADHD according or related to their race. Contributing factors or root causes of ADHD, they have found that there is a genetic link between blood relatives. Often parents that have it have kids that have it. Exposure to environmental toxins, things that happen during pregnancy can contribute to ADHD. Premature birth and low birth weight, and it's unproven but highly thought that screen time, excess TV, and video games contribute to ADHD. This is Maslow's hierarchy of needs, and I'm not going to go over it a ton because we are limited on time again, but I have under met is physiological, and then unmet. You can see listed there safety, love and belonging, and self-actualization. The unmet is because they are impulsive, and so when it comes to safety, often they're getting hurt more often than other people. Love and belonging, like we already said before, the parent-child interaction could be a little neglected. And the graph that's over to the right was just one that I found that specifically related to ADHD, and I found it interesting to read all the topics that they have listed under there. Specific concerns, communicable diseases or infections. ADHD isn't, it's something that you're born with, and so it's not contagious. It doesn't make you more susceptible to catching something from someone else, but I believe that people with ADHD are more impulsive, and so they have a tendency or a higher tendency to put themselves in situations where they could use drugs or tobacco and have unsafe sexual behaviors that could indirectly cause them to have some other health issues or diseases. Specific concerns related to ADHD or non-communicable diseases. I have 5 listed here. These are the top 5 that I found, which are behavior problems, learning disorders, peer problems, increased injuries, anxiety, and depression. So with behavior, these children's often act angry or defiant around adults, and they can respond aggressively if they're upset. When these behaviors persist over time or become severe, then they can be diagnosed with oppositional defiant disorder or conduct disorder. A lot of times those disorders go hand in hand with ADHD. They often have learning problems. Just a few examples of those could be dyslexia, which is difficulty reading, dyscalculia, which is difficulty with math, dysphagia, difficulty with writing, dysgraphia, which is difficulty with writing. They have peer problems. Often these kids have a hard time keeping friends or making friends, which can cause them anxiety issues or other emotional problems. Some of the examples of the anxiety that they can have is separation anxiety, which is when they're away from family. Social anxiety is being afraid of going to school or meeting people, and general anxiety, which is they could just be worried about the future or bad things happening. Specific concerns, self-care and self-harm. The self-care that I have listed here are things that they could do to try to help themselves be able to function better and get along in society better. So if they exercise, eat a healthy diet, get the recommended amount of sleep, and have good relationships with their friends and family, then they're more likely to be productive. The self-harm, I believe, is more likely if their self-care has a deficit. So they're more likely to have poor self-esteem, have more accidents and injuries because they're more impulsive. They're more likely to struggle in the classroom if they don't get enough sleep. And then they're at higher risk for drug and alcohol abuse, which then leads to higher risk for increased suicide. Specific concerns or risk for harm by or to others. So we already talked about these kids being a little bit more impulsive, and so they do have a higher risk of injuries. Some of the injuries that I found are they're more likely to get injured while walking or riding a bike. They're more likely to have head injuries and injure more than one part of their body at a time. They have a higher rate of being hospitalized for unintentional poisoning and admittance to intensive care units for injuries that can even result in disabilities. I found it interesting that girls and women with ADHD are at higher risk for cutting and harming themselves, where the boys and the men are more likely to actually complete suicide.